1 year ago this week, one of the nation's largest outbreaks in a nursing home began right here in Central Virginia. Our Melissa Hippolyte is live to tell us about the challenges they've faced since, and it's all new at 6. Melissa?
A year ago, we were right over there.
When we first met Kathy Campbell outside the Canterbury Rehabilitation and Healthcare Center in March of 2020,
are you there?
we watched her receive some scary news.
Did he test positive? He did?
Her brother, John Kozak, had just tested positive for COVID-19.
Is he showing any signs? No?
When we heard that, it was like my world just dropped.
Kozak never experienced any symptoms, but 51 of his fellow residents ended up dying from COVID within a matter of weeks.
There's a lot of people in there that I knew that are now gone.
Canterbury was one of the first nursing homes on the East Coast to be ravaged by the virus. And even though her brother survived, Kathy says the isolation of the past year has been brutal.
He's not where he was a year ago.
This recent window visit,
Hey, John. Hey, how are you doing, honey?
illustrates what Kathy is talking about.
You want me to try to get Katie for you? You don't want to talk today? No? Today I asked him if he wanted to speak to his daughter, and he said no. And that's not my brother. He was never like that.
Dr. Jim Wright, the former medical director at Canterbury, says that separation and detachment has been just as harmful as the virus itself.
I think it's been responsible for a lot of decline, a lot of worsening dementia symptoms, weight loss, and deaths in facilities.
Wright says he left Canterbury last summer after 10 years there, after being told he was going to be stripped of most of his responsibilities. He believes the decision had to do, at least in part, with his candor during the outbreak.
I really wanted to make sure that the public knew our story from the inside.
Reflecting on what happened, Wright recalls watching the virus move from China to Europe to the West Coast and finally the D.C. area.
We knew it was coming down I-95 from D.C. and then Northern Virginia.
But he said facilities did not have the test tubes to put COVID swabs into, rendering them unable to test for the virus. On top of that, the Virginia Department of Health required facilities test for everything else before even considering COVID.
So my first suspected coronavirus case, which thank God was negative, took me 11 days to get results on. 11 days.
On March 19th, Wright got the news he had been dreading. A resident had tested positive for COVID-19.
For me, it was simply a call to action, just realizing that it was there. What I remember of those first 3 weeks is fluorescent lights, patients in rooms struggling for breath, not enough nurses, not enough CNAs, not enough PPE, everybody doing everybody's job.
Now ahead at 11 o'clock, you'll hear why Dr. Wright is now advocating for changes in the nursing home industry. You'll also hear what changes Canterbury has made in the wake of the outbreak to try to retain more staff. Working for you, I'm Melissa Hippolyte for CBS 6.